This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right, sorry. So there's been a shift over the last couple of years towards using more lactated ringers for IV fluid choices. And, there's a couple studies that have looked at this over the last couple of years that have suggested that you can have some kidney problems if you use a ton of normal saline. Lots of normal saline can cause a hyperchloremic metabolic acidosis that, just looks like the patient has a metabolic acidosis that can confuse the picture, may not be ideal. And then one subset of patients that this has been kind of looked at more is in patients with DKA. And, the fluid choice in DKA can potentially make a difference in how their outcomes are. Patients with DKA are often fairly dehydrated, need lots of fluids, and they're overall sick. They've got metabolic acidosis, lots of electrolyte problems. So there was a recent study that I was kind of reading about, and then right afterwards had a patient with DKA. And the question was, do patients with DKA do better with LR or normal saline? And this most recent study was actually a subset of the patients about a year or 2 years ago. The big studies were called SALTED and SMART, and those were huge studies with like 30,000 patients to decide whether LR or normal saline was better. Those studies showed that LR was better overall. And in the subset of patients who had DKA, they looked at to see if giving LR made them potentially get off of an insulin drip quicker and potentially have resolution of their DKA faster. And it did show that the patients who got LR both had their insulin drip and then their DKA in general clear up about 4 hours faster. So it was like 17 hours versus 13 hours for resolution of DKA, and about 13 hours versus 9 hours to be on an insulin drip. So right now it does seem like there's not a downside to using LR in DKA patients, and does seem beneficial. So it's probably worth, if we're going to do a lot of fluids for DKA patients, starting with LR instead of normal saline. Any questions? All right, thanks guys.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.